Today, we'll be talking about breast augmentation, which is a procedure where we take implants and we place them in the breast to enhance the size and the shape of the breast. This is a silicone gel implant, and this is a saline implant. These are kind of the two big categories, saline versus silicone. Both shells are made out of silicone gel, all right? The difference is what they're filled with. This one is filled with saline solution, and this is filled with silicone. Let's talk about the saline one first. It's filled with saline solution, and if over time this one were to leak, it would go flat, kind of like a flat tire, all right? Your body would absorb the saline solution and it would go boop, 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 and now it's flat. They usually know pretty immediately that their saline implant has leaked or ruptured because that breast gets smaller. Now the silicone gel one, and in today's generation of silicone gel, most of them are kind of gummy bear, and so if you cut this in half, usually that silicone is not gonna go anywhere, okay? So most of the time, if this one were to leak, patients usually don't know because your body is going to put a capsule around both of these implants. And if this one were to leak, usually it's kind of like a little silent leak or a silent rupture, and it doesn't really change the shape of the breast, and it doesn't usually go anywhere, usually. It's usually found incidentally on a mammogram or an ultrasound for some other reason. When it comes to feel, patients usually like the feel of the silicone gel one more than the saline. The saline sometimes has an increased chance, and you can actually kind of see it here, increased chance of rippling, and it feels a little bit more like a water balloon. This one feels a lot more like a breast and just has a little bit more of that firm consistency. Why do people ever go with this one? Well, usually people choose this one because they like the idea that if it were to leak, your body just absorbs the fluid and you know it immediately. However, most people choose the silicone gel for its shape, size, decreased rippling, etc. The next thing to talk about is where to place the implant. So there are three kind of big categories of where we can place the implant. We can place it under the muscle, you can place it over the muscle in the subglandular plane, or you can place it in the subfascial plane. Most of the patients that I work on usually get it partially under the muscle. A lot of patients that come in for breast augmentation have relatively modest sized breasts. And so the thickness of their breast itself is usually less than 2 centimeters. And so when you place it under the muscle, it allows for the breast to have a nice enhancement of its size without showing the edges of the implant, so that the breast augmentation doesn't look kind of stuck on, or you can see the round implant there. People usually want to have a natural look and want their breast to be bigger, but to look great and natural and not have the shelf or the edge of the implant being so visible. And so that sometimes is the risk when we place the implants in the subglandular plane if the patient has very small breasts. Sometimes we can place them in the subfascial plane under the fascia overlying the pectoralis major, which is the big chest muscle. That sometimes can hide the implant a little bit more in patients that don't want to go under the muscle, but they also want some extra protection from the edges of the implant. Another thing to talk about when it comes to breast augmentation is the size. And that's something that a lot of patients, when they come to consultation, have a lot of questions about. It's a three-dimensional object, and so you have to consider not only the width and the height, but also the projection. The biggest thing to consider when we're talking about breast augmentation and the size of the implant is the patient's anatomy and their chest width and their breast width, okay? And so in the consultation, I always measure how wide someone's chest is and how wide their breast is. If you measure, let's say for instance, 12 centimeters wide, okay? Ideally, I would like to have an implant that more or less is in that 12 centimeter range. If I go and I take a 14 and a half or 15 centimeter implant and I try to place it in a pocket that is supposed to be this wide, now all of a sudden you have issues with the implant stretching the breast tissue out too much. It may hit the patient's arm, it may move south. It just kind of distorts the dimensions of the breast augmentation. Conversely, if you have a patient who's this wide and I place an implant that's this wide in there, now all of a sudden the implant is not filling out the breast. It is not giving that nice round appearance. It is not enhancing the breast in an appropriate fashion. Really being cognizant of how wide the patient's chest and how big of an implant, width and height wise, I can place in there safely, is a super important thing. And so that, in my mind, puts some parameters on how big someone can be, at least at the initial augmentation. Another thing to talk about when it comes to breast implants is common risk and things that can happen during the surgery. Bleeding, infection, poor wound healing, those are kind of risk of any type of surgery. Okay. Specific to breast augmentation, some more common things that can happen is something called capsular contracture, which is where the scar tissue that is around the implant can get a little tight. When that happens, it depends on how tight it is and how uncomfortable it makes the patient to determine whether or not we need to actually do something about it. And there's a grading scale for that. Additionally, as I mentioned before, sometimes these implants can leak, the silicone gel ones. And usually the recommendation is to remove the implant and replace the implant with a new one if that were to happen. And also, sometimes over time, the implants, due to gravity, need a little tune-up, so to speak. And so I always tell the patients, especially the younger patients, people in their 20s, 30s, 40s, and even 50s, when they come in and they get an implant, these are not really meant to be lifetime devices in general, okay? And so usually over time, there is another something down the road that needs to be done, okay? Whether that's, doc, they were nice, high and tight, and it's been 10 years, and now gravity's worked on them, and now they're sitting low, and I need them pushed back up, or I need a little lift, or, on my mammogram, we found out that one is leaking. There is usually some other procedure down the road where the patient has the implants taken out and something is done. Or it could just simply be, doc, I love my implants for a long time. Now I feel like they're a little heavy and they don't quite fit my frame, and I want them out. And so that also sometimes happens. And so all in all, great procedure. These are great devices, very safe. We use them all the time. This is Dr. Bond here at North Texas Plastic Surgery. Thanks for watching the video. Like and subscribe and follow along.